We're going to be talking about the first aid kit. Um, it's an interesting topic. I hope I can provide a little bit of interest on this subject. So our goal is to think about not so much running down a list of items and giving you a list of what may or may not belong in a particular first aid kit, but talking about how to think about it, and particularly how it fits into the context of a bigger approach to first aid and safety in the outdoor activities that we do. It looks like a disaster happening in the woods. And then we will move on. Make sure that works. Here. This is Linda, who is lurking out there somewhere. And this particular incident happened when we were hiking up in Voyageurs, and we came to a chasm, and the wiser heads amongst us said, "That's not a good thing to jump across, Linda." And she said, "Watch me." And these are the results of that. And that's actually an apocryphal story. Didn't quite happen that way. In teaching wilderness first aid and in wilderness first responder, we typically don't spend a lot of time talking about first aid kits, which is interesting. And I think part of that is by the time you've spent 16 hours for wilderness first aid or the 72 hours for wilderness first responder, you've covered so many of the incidents, the skills, the problems, the things that can go wrong, that you have a pretty good sense of how to evaluate what you want to have along on a trip. And interestingly, several years ago, I did a survey of half a dozen kayak guides who led trips professionally. And so they had a lot of experience taking people out in different locations. And I asked them, "Can you tell me about some of the more recent first aid incidents that you've dealt with?" And I got about 50 back, and they ranged from cuts on coral or rocks to evacuations in the helicopter for a quadruple bypass heart operation. And one of the interesting things I noticed about this list was the majority of incidents listed had nothing to do with first aid kits. They involved judgment. They involved interventions that didn't have anything to do with the things that we think of as first aid materials. It could have been recognizing low blood sugar. It could have been recognizing incipient hypothermia in somebody's behavior, or how to assess whether somebody should be considered as possibly having a spinal injury. I mean, none of these things involve going to the first aid kit. So that was kind of an interesting awareness. And it's not to say that the first aid kit is not valuable, but it's kind of a part of the toolkit that you have available to you when you go on these trips. Now, we all know that we're in the middle of a pandemic, and this has a little bit of implication, well, more than a little bit, for first aid providers. First aid is something that you typically are going to do up close and personal. And so when we plan for it, we know that if we are going to be expecting to provide first aid, that we need more personal protective equipment than we typically would in non-pandemic times. And this is primarily the mask, and a good mask. Now, I commute to work on my bike, and I typically have a modest first aid kit in my bike bag, and I have a CPR mask, and I have gloves, and now I have a N95 mask in case I come across any incidents, and that has happened. I've used that kit a number of times, mostly for wounds and crashes, but I've also had several cases of some unresponsive people dying from either drug or alcohol overdoses. And you start thinking about how do you protect yourself. The very first time that happened, I thought, what do I have? Am I going to have to possibly do CPR and rescue breathing on this person? And after that, I started carrying a mask so that I would be more comfortable providing that care. Fortunately, I've never had to use it. So I have a first aid kit in my pack. I have it in my bike. I have one in my car. And that includes gear I need in order to feel comfortable providing care under the current circumstances. I was running around Lake of the Isles about a week and a half ago, and I don't carry a mask or wear a mask when I'm doing that. It's very easy to stay a minimum of 15 feet from other people at the time of day I'm running. And I got to the east side of the lake and I heard this crash. And I looked up and there was a cyclist lying on the ground next to his bike. And my immediate thought was, please get up, because I would prefer not to deal with this. But he didn't get up, he didn't move, he was unresponsive, and I approached and as carefully as I could, made sure he was still breathing. We got 911 called, and kind of have a lesson now that it will probably never happen again, but now in my running shorts, I will throw in a mask and gloves should it happen. Things that we are very comfortable doing in non-COVID situations take a little extra planning. So on the topic of what do we do about a first aid kit, there's a simple answer. And you can go to REI or Midwest Mountaineering. This is the website from National Outdoor Leadership School's Wilderness Medicine Institute. And there is an array of first aid kits here. And they have them nicely numbered, numbering from 1.0 to 5.0. And the cost goes from $16 to $85. And basically, as the price goes up, you get more stuff, you get more bulk. And you can make an evaluation on what you need here based on the number of people and the length of time you're out. They have guidelines. And there's nothing wrong with this approach. The core contents of most first aid kits are going to be very similar. You could go to other providers and probably find the equivalent in the range of kits, the sizing, the contents, and everything else. There'd be relatively little difference. So we could end a talk like this right there and say, okay, go and make your choice. And if you're going to be out for a longer period of time, you can go with the 4.0. And if you're just hiking, go with the 1.0. But we can go a little farther than that today. Let me talk about the most important items that you have in your first aid kit. Number one is your head. It's what you know. It's how you think. How mindful you are in recognizing situations, and it's the training you have behind you. You all know probably the acronym STOP, which is used in addressing and orienting yourself in any number of emergencies, particularly when you get lost. It stands for stop. Just stop. Pay attention and don't react quickly or rush into anything. The second T there is think. You know, give it some thought. Use your head. Use what you know. Always observe. Pay attention to what's there. Be mindful. And then P is come up with a plan. And so this isn't necessarily anything unique to first aid, but you've probably run across this in other outdoor situations. The second thing is preparation. Be prepared. I mean, it's a great motto. Think about what can go wrong. Think about the participants. How many do you have? Do you have any participants with medical issues? Where are you going? Is there anything unique to the location that would call for, tell you what, it may or may not tell you anything to change in your first aid kit, but it might tell you what to expect. Think about the weather, think about the heat, think about any hazards unique to that location and what you're doing. How about communications? If something happens, are you able to communicate? Communications in the things that we do can range from being totally out of touch, and many of us often are, and that has kind of a blessing to it, to being fully in touch from anywhere you are in the world. You can get devices now that can connect you from virtually anywhere. I took a satellite phone once on a canoe trip with scouts on the Missouri River because I had a boy along who had a mild case of cerebral palsy. He had a shunt in his head that drained fluid into his chest. And if that got plugged up, things could get very serious. And so we needed the ability and had a check beforehand what his emergency options are. And there was one bridge in the 120 miles of our route that cars could cross. So we knew that we likely would be looking at a helicopter evacuation in a significant urgency should something go wrong. But there is that spectrum, and it's a choice we make, but it's something to be aware of. In any trip, what are your evacuation options? If you're going down a river, where are your takeout points should something bad happen? And another thing that is good as part of preparation, and it's a part of how you think, is having an understanding of the things that are beyond the first aid kit. What are the red flags? How do you identify when you need to get somebody out of there? You know, when we look at some of the signs and symptoms, maybe of abdominal distress, when do we say, okay, it's time to evacuate this person? The third thing I have on my list of the most important items is a wilderness medicine field guide. And this is one that Knowles puts out. There are several people who make them. They're all good. They're all valuable. This is a very abbreviated one that same company provides. And one of the nice things about this is that it gives you some of those evacuation criteria so that, you know, when do you decide that an allergic reaction requires an evacuation? When do you decide that a wound needs to be evacuated? And so something like this, even if you've never had a wilderness first aid course, gives you a great resource and can tell you how to respond to a situation and help you along on that. So these three things, I think, are the most important items in our kit, thinking of kit in the broadest sense. And if nothing else, have these, and I would rather see somebody with these present and no first aid kit than a great $85 first aid kit and falling short in these categories. So one of the first things is, as we kind of move beyond just solving our first aid kit by going to the store and picking up something that feels right, saying, well, I don't want to spend $85, but this one in between looks like it's nice. And that is not, you know, I'm not saying there's anything wrong with that. And in many cases, going to the store and starting with one of those first aid kits is a great first start. It's also a way to get a lot of stuff economically. So I'm not dissuading anybody from going and making an educated decision on buying a prepared first aid kit. That's what 90% of us are going to do. And then we can make some tweaks to it and make some changes. But wherever we go and whatever we do, the starting point is that everybody should have a personal first aid kit. And I think this is particularly true in the time of the COVID pandemic, when by being able to take care of yourself, you can maintain physical distancing that might otherwise be necessary. And the personal first aid kit is personal. I mean, it's things that you think you would like to have and that you need. Some obvious ones are Band-Aids, blister care, particularly if you're hiking or doing something that might involve blister. Sunscreen, tweezers are great, duct tape, medications, over-the-counter medications that you use, and any prescription medications that you use. Insect repellent, and also in this day and age, personal protective equipment. Throw some gloves in and throw a mask in. The whole point of this is so that you can take care of yourself, and you don't have to be going and asking a trip leader or another participant for a Band-Aid. You can add aloe if sunburn is a possibility, tape or an ace bandage if you're hiking. But here it comes down to you looking at the activity that you're on and the location you're on and deciding what is it that you want to have to take care of yourself. And then we move on to kind of the broader topic of first aid kits. One of the first questions is, who are you responsible for? Who are you taking responsibility for? Now, this could be responsibility because you are the trip leader, the trip organizer, the trip host, and you have some responsibility for the trip and who is on it. You also would be looking at how many participants are there. Like 2 bandages might be inadequate when you're going on a trip with 15 people. And are there any risks unique to those activities? If you are going to, let's say, Baja, I think I heard that in your kayaking there, they have jellyfish, right, Fran? Fran's off as a cat. And one of the treatments for jellyfish stings is vinegar. And so vinegar would be something that you might add to your kit for that scenario. Some places, some activities, you might go a lot heavier on materials for dealing with blisters. And so we want to look to what might come up there. Is seasickness possibly going to be an issue? And how long is the trip? Something that might get you through a day is going to be a different set of equipment than what you might want to take on a week or 2 weeks of paddling or backpacking in a remote area. Now, if you have gone out and looked at the kits that are commercially available and you've bought one of the first things I would do is open it up and go over what's in it and think about, do you know how to use everything in here? Do you know how a kit would often have moleskin in it, for instance? Do you know kind of how moleskin is used in treating the blister? How it's used to build up the donuts, and what other things are in there? Do you know how to use tincture of benzoin, which is a vial of this stuff that can become kind of sticky. And so you may find these things that come in that kit, particularly the larger ones, that you're not familiar with. And that's a good time to read any accompanying material or to go out to the website and do your homework. What do I use tincture of benzoin for? What are these funny little strips called closure strips? How would those be used? So go through that kit and make sure that you're familiar with everything in it and how to use it. A tegaderm bandage is a different animal than the gauze that we might put on a wound. One is changed regularly, one stays on until it falls off, pretty much. So familiarize yourself with that kit. And then as we think about further things, you may decide that you can leave a few things at home or add a few more things or increase the quantity. Let's go on. So here are some, I kind of break my contents down into different categories, and these are fairly common. But we look at wounds. This is one of the most common injuries that people kind of experience. But one of the most common, one of the most dangerous areas of any trip is the cooking area. It's where people get cuts. It's where they get burns. So wounds, soft tissue injuries are a common occurrence. And I have listed not, you know, in listing these, I'm not listing an ideal first aid kit, not an ultimate first aid kit. I'm listing some of the things that you might think about as you look at your kit and make decisions on what you want to take with you. Band-aids are very, very common, and if you're ever out with a youth group, I used to measure scouting weekends by the number of either band-aids or wound dressings that I applied. I think my record was 8, where somebody would come with a cut or an injury. I would treat that. So I think 8 was my record. But I never had to send anybody to the emergency, so that was good. So in dealing with wounds, a lot of people like liquid bandage. Very good for nicks and stuff. Tape, closure strips. I don't know if everybody's familiar with the closure strip. It's used for closing a minor gaping wound. If the wound is more than, let's say, 1/4 inch or so, we want to evacuate that person and probably not close it up. But a very small wound, if you clean it and irrigate it, you can use a closure strip. So this is something else to be aware of and learn about. Tincture of benzoin is a great resource. I don't know if anybody has ever had the experience of putting a great blister dressing on a heel and building it up, and 20 minutes down the trail, that dressing is, that bandaging is at the bottom of your foot. Tincture benzoin is something that lets you give more adherence to the bandages that you apply. It's the sticky stuff that you brush on, it dries, and then it gives you more. It's great for having blisters dressing stay in place. An irrigation syringe. We always have antibiotic ointment or cream, but an irrigation syringe is just a big plastic syringe for squirting water. You can scare kids with it when they've got a dirty wound and you pull that out because they're sure you're going to inject something. But it's really a high pressure irrigation device for cleaning out a wound. And with a wound, we don't want to put typically antibiotic ointment in the wound itself. It's fine to put it around. It's fine to have it perhaps coating the gauze that goes on top of it to keep it from sticking. But the way we keep a wound from minimize the chance of infection is to have that wound clean. And that means copious irrigation with clean water. water, we want water that's clean enough to drink. And that irrigation syringe, that plastic syringe, is the best tool for doing that. In the absence of that, and we do wind up improvising a lot, even with the best first aid kit we have out there. A water bottle that you can squirt and spray. It can be a little challenging, but you can take a plastic bag, wrap it up tight, have a small hole in a corner, and you can get a little bit of pressure that way, but nothing comes up to that plastic syringe. It's way better than putting a lot of antibiotic ointment in the wound itself. Tegaderm is what they call an occlusive dressing. It's transparent and it breathes, and you put that on a wound after you've thoroughly cleaned it, and you have a couple advantages. You don't have to change it, and because it's clear, you can look at it, look through it, and see whether any signs of infection appear. Tegaderm, Tegaderm is a name brand, but there are multiple that make this occlusive or semi-permeable dressing, different sizes. It's great for, one of the great uses is on an abrasion. Cyclists often carry big sizes of this. So when you get that road rash, you get a nasty abrasion. Again, after you've cleaned it up, it creates a great healing environment. And so it's a big improvement on just putting gauze on it and wrapping it up. Roller bandages on gauze pads. These are hard things to improvise in the field. Clean gauze, sterile gauze. And so I like to have plenty of that, even if I'm just using it sometimes to clean something up. And a roller bandage is something that you can use multiple. I get sterile ones. I put them in a plastic tube. If you have to improvise some kind of dressing, you can cut that up. You can also use it to hold the dressing in place. You can use it to hold the splint in place. So it has a variety of uses. Vet wrap is a wrapping bandage. I don't know how you're, but it's self-adhering. It's got a little elasticity to it. It holds very well. And it's a way, again, to secure both a bandage or a splint. So some of these things have multiple uses. Medications. I typically take pretty much the ones I have listed there are the common ones that I would carry. Acetaminophen, ibuprofen, that's Tylenol and Advil. They are your over-the-counter, primary over-the-counter pain relievers. Some people prefer different ones, and they might carry those. At times, I've also taken Excedrin, because there's some people who really like that. And, those come along. Aspirin, I include because it is a valuable thing to have there in case you suspect a cardiac situation. So that's the primary use of aspirin as far as I'm concerned. Benadryl, antihistamine, it's something that if somebody has an allergy, not only is it a treatment for mild allergies, but if somebody ever has to deploy an EpiPen, it's something you want to give immediately afterwards to prevent the recurrence of the anaphylactic reaction. And cortisone cream, which I take for things like itching or skin irritations. I haven't listed any prescription medications here. And typically they're not appropriate for the kits that we're putting together. If we were going on a crossing the Atlantic, I would talk to a physician advisor about things that I might want to consider having along. And I would like to also have the ability to count on communications And typically we're looking, the primary things we would look at there would be antibiotics and pain medications. Our goal in the wilderness, though, is to manage pain, which is why we like to avoid the prescription painkillers. The over-the-counter medications have no impact on our mental status, which most of the prescription painkillers do. And we really want to have a patient in the field who can report his symptoms back to us, with whom we can check his mental status or how she is feeling. And so we don't want that dulled or numbed. And so that's why we rely on our over-the-counter medications. There are other things that you can add if you want. Antacids, you can have various types of stomach soothers. I will sometimes have, I've never had a need to use it, anti-diarrheal over-the-counter medications. And I have brought ginger gum for seasickness. Nobody has ever asked me for that. And a couple of these things, I think, in the latter category, have a nice placebo effect, and there's nothing wrong with that. I know I've been asked for some stomach things at times. I have no idea whether they really work, but the patient got better. So that works out just fine. One thing about medication is to be aware of the expiration dates, and by that I don't mean that most of the over-counter medications that we have, and this is not necessarily, this is not true to the same extent with all prescription medications, particularly some that are very essential to health. Most of your over-counter medications probably have an effective life of at least 9 or 10 years past the expiration date. The Army did a lot of testing on the over-the-counter drugs that they provide and found that the efficacy is way beyond the expiration date. And that said, there are two criteria for paying attention to that, because I provide people at times with some of these medications. I like to be able to, I want to be able to give them something that didn't expire 5 years ago, just because it looks more professional, and it's a way of making sure that you're providing the best for your patient. If it's just me, I don't care that much, as long as I know that the medications have not been exposed to a lot of heat. That's probably or moisture. That those are the two things that can cause it to break down. And so that's something to be aware of in maintaining your medications. Also looking at blisters and burns. Burn, there's I think it's called burn gel. And there are several types of these. There are burn pads, there's burn gel. These work very well in relieving the pain of burning. As far as blisters, there are some blister pads that come pre-made that are kind of soft, provide a little cushioning. I would use tincture of benzoin when I put those on, so that they stick better. The tincture of benzoin goes kind of around the edge and where the adhesive stuff goes. Moleskin is something that you typically will cut to make donut shapes, and so it's good to have scissors available. Another thing when you're applying blisters, another handy thing to have as we move down to the next category of general stuff is alcohol wipes. If you clean skin before you apply it, any kind of bandaging, the bandage is likelier to stay there longer. And with blisters, I like to clean it with an alcohol pad and then use the tincture of benzoin. Put a thin coat of that down, let it dry, and then I apply my bandage on top of that, and it sticks much better. So in your general stuff, gloves. Gloves are something that I like to keep accessible, as well as anything that I would want to apply to a significant bleed that I don't want to go rummaging in my kit to pull it out for. So gloves, hand sanitizer wipes, alcohol wipes, trauma shears. Trauma shears can be handy for a number of things. Scissors, tweezers, we pull ticks off. Safety pins are a very handy general item. It's something you can put in your personal kit as well as here. You'll find those have a variety of uses. Duct tape, the ever happy duct tape is good to have around. I keep a little headlamp, a very small portable headlamp available. And pencil and paper, and of course the field guide. I also will throw in a pair of reading glasses simply because I need them to see things up close. It's not going to help me find a tick or something small or get anything out without my glasses. So I need those reading glasses handy. And then finally, we can get down to how are we going to address musculoskeletal injuries. And here we're talking about, we talk about fractures or very serious sprains. And our treatment for a significant sprain and fracture is essentially going to be the same. We're going to immobilize that. And part of it is that we have no way of assessing in the field whether a bad sprain actually involves a fracture. And so one of the things that's very handy is a SAM splint. I don't know if everybody is familiar with that, but it is I should have brought one in from the other room. But it's a 36-inch thin aluminum that has a foam covering over it. It's very pliable. You put a U curve in that and it becomes very rigid. And it packs up small, it's very light. You can use that to in a variety of ways for splinting injuries. Yeah, there we have a SAM splint. See, and it's light as a feather. That unfolds to probably 36 inches. And it's very floppy until you put a U shape in it. And once you do, it's just the engineering principle that provides rigidity to it. Very handy thing. It's very light. Ace bandages are good to have. If you take an ace bandage, and that's another multi-use thing, you can use that to provide some support for a mild ankle sprain or a wrist tendonitis. One thing about an ace bandage is many of them come with these cute little fasteners. You can count on those disappearing quickly. And so they come with Velcro, or you can use duct tape. When you get that bandage on, you can just put some duct tape on and it's going to stay in place. An ace bandage you can use for putting a bandage in place. You can use it for fastening a splint. You can use it for providing support all by itself. Athletic tape, if you're on a rough trail, rugged trail hiking, and there's an ankle sprain, athletic tape is a great way to provide support for a sprained ankle. It does help, and it's rather important to know how to use that tape. There are some simple ways of taping an ankle, and there are some ways that take a little bit more knowledge, and it's good to have a field guide that can tell you something about that. If you have the ability to provide ankle support, it's going to be a lot easier on your patient to self-evacuate. You lighten up their pack, you distribute their stuff, you get them something to support, either hiking sticks or a stick, and give them some support, and you can get them out of there that way. Triangular bandages are another multi-use item. You can make a sling out of it. You can swat that sling with a couple of those. You can use it to fasten a dressing on. You can use it to fasten a splint on. So that's another multi-use item. So we've gone through, I think, the core of things that you can think about with a first aid kit. You can pick and choose. You may find some things that you add in addition to this. You can determine the quantity based on how many people, how long are you going to be out. And another thing that's important to keep in mind on a first aid kit is it's not something to build and throw in a bag and then forget about for 4 years until you need it. Bandages and anything that has adhesive, and a few things are more embarrassing than somebody wants a bandage and you take it out and it's come apart and there's no adhesion left on it. And there are things that I think should be reviewed. If you know, I had a pair of gloves in my bike bag for a couple years and never looked at them. It was in the outside mesh pocket. I don't know if you can see here, but it's starting to deteriorate where it was in the sun and it got rained on. So, you know, you need to replace these things, and if gloves are around long enough, you go to pull them on and they tear, and that's kind of embarrassing when you're there as a first aid provider. Again, medications, pay attention to those, and things like your closure strips. I try to replace those every year. And one of the things that works for me is that I can take stuff out of my first aid kit, bring it to a first aid class, and they can use it there, and we can use it up, and I put new stuff into my kits. So we've kind of gone down this. These are things you have there. And you know, we have different kits. There is no single kit that most of us will have. And we'll jump here. These are the kits I have. I have a different set of stuff when I'm a bike medic. One of the core things I'm out there for in a bike medic is I'm carrying an AED. I'm carrying basically prepared to provide CPR in the case of cardiac collapse. But we also have other supporting stuff. We didn't have we typically did not think a lot about if we had minimal wound stuff all along because you're always kind of prepared. After the Boston bombing, we now tend to carry more serious trauma stuff. I carry a tourniquet, carry military battle dressings. You know, not a ton, but there are a handful of those in my kit now, and a lot more gauze than I typically would take. So we kind of are citing this to, you know, things that have changed. I have a first aid kit I take when I commute on my bike. I've used it. Kayaking is my most comprehensive first aid kit. It's all in a dry bag. It's rolled up, keep everything dry. And the contents of this are 5 or 6 Ziploc baggies for different where things are organized. For a hike, I have a much smaller one. And then there's, you know, what you carry in your car. Remember personal protective equipment, to which we have added the mask now. And those are kind of, I think, the key of kind of how I would like to think about the first aid kit. I would go back to the things that I said are the most important things to have. Whatever else you do, it's your head, your thinking, what you've learned, being prepared in advance, and having a wilderness field guide along. Even if you forget your first aid kit. The last slide here, I can send this out. These are some wilderness first aid resources, and these are places where you can get field guides, you can get apps for your phone, you can get a soap note app, you can get a field guide app. You can get other resources, you can get supplies. The last place down here, Center for Wilderness Safety, is great in that you can get very small quantities of stuff. You can go out there and buy 5 bandages if you want. You can buy medications by individual packages of 2 pills. And this is a very nice option to have when you're refilling stuff. And you can buy, you know, as many from 1 on up, and different gauze pads, Tegaderm pads, bandages, and everything else. So that would conclude what I have to say. If anybody has any questions, I'd be happy to ask or happy to answer, and attempt to answer at least. So I will open it up, and you can unmute yourself. If you're not going to be unmuted en masse, just press your bar down, and if there's anything I haven't been clear enough about, ask me.
Great presentation, Tom. I appreciate it. My primary question, with the COVID, the CPR masks that you might get, do you know where I might get one easily, just individually, or a couple of them?
CPR masks or N95 masks?
The CPR ones, yeah, I've got.
Okay. Any of these places out here, or no, I wouldn't say any of them. The Red Cross I don't have listed, but Center for Wilderness Safety I know does. Many of them provide the you know, the professional grade pocket mask with a filter built into that, and so that's what I carry. I've got about 3 of these.
Yeah, that's what I'm looking to get.
This one, okay. Knowles carries it. I wouldn't be surprised if all these people did. Red Cross does as well. I don't know anybody who carries it in a local store though.
Right.
The Red Cross used to have a store where they carried that, but they don't anymore.
Thank you.
Sure.
How do you feel about the use of super glue as a cut holder?
People use it. You can certainly buy what they call medical grade super glue, but really I'm not sure that there's much difference between it. My training has been to use the closure strips. I like those. I can see clearly, you know, what's there, and it's easy to undo those if you start seeing signs of infection. But super glue, people use it. Physicians have used it when that's all they have access to. But one thing about a wound like that is there is the possibility of an infection with a wound you're closing like that. And I like the ability to easily undo it so it can be re-cleaned and consider maybe leaving it open if need be for drainage and packing it instead of doing it. So it's a tool. It's an accepted one and a good one. I only have that one reservation about it. I like to be able to undo things.
I have fears that there's something in that would get in your bloodstream that's not supposed to be. Pat, Ryan, do you have an opinion on that?
I do. I can tell you that what I think the most important thing is, and I think it's something that Tom brought up, is clean things probably twice as long as you think you need to clean them. So that you've got really good irrigation and using soap and water, even if it hurts people, so that it's cleaned, and then you will have much better healing. But I'm kind of a fan of putting on those steri strips if there's some sort of a wound so that you can approximate the edges, and then dumping is the wrong word, placing a little bit of super glue on top of that, and there isn't any difference between medical grade and the other grade, except for the medical grade is colored purple. And putting a little bit on top of that so that you actually get some really good sealing and things don't get into it, because you've really done an excellent job of cleaning it off. That way you'll have, especially if you're doing a lot of outdoor activities, I think you'll keep it from getting dirty again. And you can, if it really does look bad, you can lift up the edges of the steri-strip and take it off really easily. But you're ripping it open then. The goal, I think, is not to. The other thing I wanted to mention, that instead of the reading glasses, which I have on my face at all times anyway, I have a really cute little, very powerful fold-out magnifying glass with a little light on it that I use for just about everything to make sure that there's no dirt in things. And I would suggest that everybody has like 3 or more masks in their car, because if somebody's sick, there's going to be all these people lurking around also. And you want to give masks to everybody, not just the patient, but you and all the other people that are their friends that are lurking around. And then vet wrap, some people know it as Coban. I just wanted to mention that. That's a brand name that I think a lot of people will see. And then one other thing that I'm a fan of is that over-the-counter cortisone cream, and I get asked for cortisone cream all the time, or cortisone ointment. I always bring ointment. It stays on much better. But I don't go with the over-the-counter stuff. I look around my house and see if I have something really strong. And you only need a little bit, but rub it in really well, and it works so much better. The little 0.5% cortisone ointment that you get over the counter is all right if you're doing large area, but it doesn't really work all that well. So those are the only suggestions I have. Thanks for the presentation, Tom.
Sure. Yeah, one thing, Coban has kind of the relationship to vet wrap that Dermabond has to super glue, which is essentially the same stuff except significantly more expensive. So if you go to Fleet Farm and buy vet wrap, you get it a lot cheaper.
Yeah, in the horse aisle,
yes.
I might add.
Right. Yep.
I think medical grade just refers to how much they get to charge for it, isn't it?
Yeah.
I think so.
Hi, this is Karen Krennick. I don't know if you can see me or not. I'm on my iPad. I just had 2 comments. One is we're moving away from the use of antibiotic ointments. The dermatologists usually have people put on Aquaphor or Vaseline instead, because there's a fairly high percentage of people who have allergic reactions to the antibiotics and the antibiotic ointment. So I might just bring some Vaseline or Aquaphor along. And then the other comment would be is if you do have like a witnessed cardiac arrest and you don't feel comfortable doing breaths, at least do the chest compressions. Because that is actually what does the most good. And so I think some people are just afraid to do CPR because they don't want to put their mouth on somebody else's mouth. So if you can do the chest compressions, that does benefit the patient, until the ambulance can get there.
I was going to ask about antibiotic cream, and so you answered my question with that, but why don't you put that right on the wound?
Well, yeah, it is that if you have cleaned it and irrigated it under pressure with a copious amount of water, that's the most effective thing you can do to keep it clean. The other is that, as Karen said, if you're going with the triple antibiotic, which is why I carry a double antibiotic, but although I never really use it except sometimes when I want kind of an ointment on top of a pad, the antibiotic gets in the way of healing. It heals better without the antibiotic on the tissue, the wounded tissue.
I didn't know that. And this is another good, if I can get it in front, this is another good light and magnifying glass.
Right. Taking a picture.
You take
And
a
then
picture and make it bigger,
and make it bigger.
and you can look at it, and the light is really strong, just in case.
Tom?
Thank you, Tom.
Tom, I have a question. There's been some discussion here about chest compressions and all of that. You're in a wilderness situation, especially like in the boundary waters. You're not going to have someone coming help drive you off, obviously. What are your thoughts about CPR in a real wilderness situation? Do you even attempt it?
Yes, a couple things on that. Chances are, and some of it depends on the cause. If somebody's cardiac arrest is caused essentially by an unhealthy heart, if they're experiencing sudden cardiac arrest due to a medical condition, it's going to be difficult to bring that person back. If you look at the success rate of CPR for out of hospital cardiac arrests, when there is no defibrillation and there is no rapid response that gets somebody to advanced care, CPR alone has a very low success rate. And this is you talk about the cardiac chain of survival, that in order for somebody to have the best chance of surviving, you activate 911 and you start quality compressions and you get that defibrillator on, and then you get them to advanced cardiac life support. Now, if somebody's cardiac arrest is secondary to respiratory arrest, so let's say drowning, we're going to give that a shot. That person may be healthy, have a healthy heart and a healthy situation, and so we're certainly going to try there. There are wilderness protocols that say typically if you've been doing CPR on somebody for 30 minutes and there's no response, with one exception that I will get to, it's appropriate to stop because you don't have the things. CPR is a way of keeping somebody alive until they get the help that they really need, and they get the defibrillator, get advanced cardiac life support. Now, the exception to this is a lightning strike. A lightning strike can both stop your heart and stop your respiration. And in the case of, in typical triage where somebody looks dead, we move on to the other patients where we think we have a chance of providing them with care, that we don't want to focus on this person who's obviously dead. Well, somebody can be apparently dead after a lightning strike, and they can be brought back with CPR. And one of the things to be aware of there is that your heart may come back before your respiration comes back. So somebody may get a pulse, but their respiration doesn't kick in. And so with lightning, and obviously you can't zap people and experiment on all these things, but one of the thoughts is, the way a defibrillator works is it doesn't really start the heart. An AED, it doesn't start the heart, it stops the heart. It stops a dysfunctional rhythm. And so there's some thought that many lightning strike patients whose hearts have stopped and whose respiration has stopped, their heart may come back on its own, with or without CPR, but in the absence of rescue breathing in that situation, after a little time without oxygen, their heart's going to stop again for good. I remember the goal of compression only is to circulate oxygen that you have retained in your body, and you keep that going. But when somebody has cardiac arrest secondary to respiratory arrest, you got to have the rescue breathing. And one more thing, if somebody does experience that, for everybody's sake, it's good to know that you tried. because you never know. And you can tell their family, you can tell yourself, your team, you tried.